This is Charlie. He's an approximate 12 to 13-year-old male neutered Patterdale Terrier. He was in for radiographic workup of his lumbar compressive lesion, and while he was here, the owner asked if we could please address this chronic bleeding papillomatous mass. Rather than surgically remove it, I offered to cryo or freeze this mass so that we could shorten the anesthetic exposure and decrease the cost incurred to the client. Lastly, Charlie is somewhat of a fractious dog, and taking sutures out after the fact in and of itself would have required some type of sedation. So we're going to freeze this lesion. Given its broad base, we're going to use the D3 tip. We're going to freeze it 2 cycles, approximately 45 seconds each, with a thaw cycle in between, and we'll recheck it in 3 weeks. Most of these lesions will be completely resolved. In some cases where the mass or growths are extremely thick or alternatively large, we may require a follow-up treatment 3 weeks out. Again, these are typically done without anesthesia and without any type of local preparation. In some cases with fractious animals or masses around the face or the genitalia, I will put a bleb of lidocaine under them so as to reduce the sensation at the site of freezing. Please, if you see mask and other alternative gear on, it is not for the specific purposes of treating these lesions. It is because we are following a coronavirus or COVID-19 protocol. So we're going to start on one edge of the lesion. We're going to check our time, and again, approximately 45 seconds. As we go through, we are attempting to get to the root of the lesion and knock off any ice crystals that may interfere with the rapid freeze cycle, which is necessary for destruction of the mass. Because this is very broad-based and close to the skin, and I can feel the skin getting very cold, I'm going to shorten the cycle to about 30 seconds. So we've just completed the thaw cycle, which typically is 1 to 2 times the duration of the freeze cycle. You'll notice that I'm not wearing gloves. I typically don't wear gloves, so I have a comfort level with the temperature of the surrounding skin. Again, this mass is very broad-based, but not very thick, and as a result of which I want to move quickly to freeze the mass and not to freeze the surrounding skin. It is a requirement of the freeze cycle to freeze the tissue as quickly as possible, which will form ice crystals and therefore subsequent rupture of the cells associated with the mass. So again, we're going to freeze, knocking off ice crystals as we go so as to make sure that the gas is in direct contact with the mass. Secondly, what I find is that this freezes a lot quicker than the other types of cryotherapies that I've used in the past, and I find it advantageous. It also is a lot more exacting than the cone approach to freezing. And I think that will be sufficient.